I'm Thomas Baldrick here at ASH 2014. The handsome gentleman next to me is Dr. Daniel Pollyea. He's from the University of Colorado, Denver. Thank you for taking some time out of your conference.
Yeah, thanks for having me.
Let's talk about this phase 2 study. I believe you have some good news to present here. What's this about?
Yeah, so we're pretty excited. This is a concept I've been working on for several years. We're combining two drugs that we think are quite active in acute myeloid leukemia. This is a trial for relapsed and refractory patients, and they're receiving sequential combination of azacitidine, the hypomethylator, with lenalidomide, which is a multifunctional drug that is active in many blood cancers. We give it at very high doses after the azacitidine portion, and we're finding that in this very difficult population of patients with relapsed and refractory disease, that the tolerability is good, and more importantly, there seems to be some good efficacy.
What is the need and the risks with these patients using this combination?
Right. So, I mean, these patients with relapsed and refractory AML have very few options. So these are the patients who have, failed multiple therapies and aren't candidates for standard, more intensive regimens. And so, the risk really for people in this situation is death by disease progression. And so we're trying to do everything we can to prevent that from happening. There are certainly side effects to this regimen that we are becoming much more familiar with and adept at treating. And there are some real toxicities, but our goal is to prevent death by disease progression.
What's most significant in the findings you have here for ASH?
Yeah, I think the most significant finding we have is the overall response rate, which is this is just an interim analysis we're doing now, but it looks to be somewhere between 40 and 50%. And for a population of patients that has this difficult disease to control and has failed this many regimens, that's actually quite promising. So I'm hopeful that we can finish the study, finish accrual, see what the final numbers are, and I'm optimistic they'll hold up, and this could represent a real option for these patients.
So you see this combination as having a future?
I hope so, yes, yeah. I mean, there are a lot of other great therapies that are coming online, many of which have been presented at ASH this year, and there's other great things in the pipeline, but I think this regimen will have a place, yeah.
Congratulations, Dr. Pollyea. We invite you back to update us as the need arises, okay?
Great. Thank you very much.
My pleasure.